Hello, so today we are going to talk about asthma pharmacology. But before that, we should know that what is exactly asthma. So, if we see the definition of asthma, basically the asthma is a long term. This video is only for revision purpose, so I will just explain it in a quick manner. So asthma is a long term, and I will not write much, so sorry for that. So basically the asthma is a long term inflammatory disease of airway of the lungs. We know that the airway of the lungs get inflamed due to certain allergens, or it may be due to the cause can be genetics or environmental factors, and the patient will feel wheezing, means we can hear wheezing, or the patient will feel tightness in the chest, okay, or there will be like shortness of breath and other symptoms will be there. And the risk factor mainly is our air pollutant. Okay, let's not write that because it's about pharmacology mainly. I'm just telling you extra information. So basically air pollution or any other allergen, and usually the patient is child over here, okay, and we will just diagnose it by the spirometry. And basically in the treatment we will refer not refer we'll prefer patient that to avoid that particular allergen. Now let's come to the pharmacology. So in the pharmacology, or we can say in the treatment or management, so what exactly is there in asthma? In asthma there is basically bronchoconstriction, right? So for that we will give here bronchodilation, okay. So in that we can give like beta 2 agonists, anticholinergics, and like methylxanthine, etc. What else we can give? We can give steroids also, which is very important part, okay, which also play very important role in asthma. So first let's talk about this bronchodilation. In case of bronchodilation, there are certain medications, like for example, just I have told you that beta 2 agonist. So what is exactly beta 2 agonist consist of? Okay, so that is like SABA and LABA. SABA is actually short acting beta 2 agonist, and LABA is long acting beta 2 agonist. These we can use in asthma, particularly we all know that, right? And another one is anticholinergic, right? Anticholinergic, like the drugs which are which consist of tropium, okay, tropium in their name. So that these drugs are basically the anticholinergic. Another drug is the methylxanthine. So methylxanthine is for example theophylline. Yeah, theophylline is a methylxanthine. Another one is like amyphylline, yeah. So amyphylline, the difference between that the theophylline is like very toxic. If the dose is more, then it will be toxic, so we give it orally. And this amyphylline we give it intravenously route, okay. So this theophylline have various side effect, but one of the most how to say hazard side effect, that is arrhythmia, yeah, arrhythmia and seizures, okay. So basically we can say it is affecting heart and it is affecting brain, okay. So that's gonna quite create a problem, right? So basically let's just discuss about this theophylline a bit, because it will play important role in our medical field. So theophylline dose is 5 to 15 mg per liter per L, normal dose, okay. And if it's more than 20 mg per L, then it can lead to what? It can lead to toxicity. That we have to remember. Normal dose should be 5 to 15 mg per L normally, but if it's more than 20, then that will be what? That will be toxic for the patient. So that will create like a very hazard condition if we not focus on this dose. Let's continue further. Another category, yeah, we have talked about bronchodilators, right? Then another category is this one, that is IgE blockers, okay. Like for example omalizumab, this is also can be prescribed in case of asthma. And another one can be mast cell stabilizer. So the mast cell stabilizer, like for example sodium chromoglycate, okay, sodium chromoglycate, and like nadochromyl also is there, okay, and like catotifen is also there. So we can use these are mast cell stabilizer. Fourth category is the anti-leukotrienes. Remember the anti-leukotrienes, maybe we have read it about in the second year. So the anti-leukotrienes, they are for example basically xylitol. Okay, so this one and another one is like anti-leukotrienes receptor inhibitor. So these are montelukast and like zafirlukast. Okay, so these leucast, okay, these two leucast, they are associated with a syndrome that is known as the, they are associated with what, they are associated with a syndrome that is known as the Churg-Strauss syndrome. Yeah, we know that. And other, we can say like corticosteroid can also be used. Okay, we will gonna come on that topic. For example, let's talk about this steroids. So for example, there are various ways of taking steroid. Either we can take is like by inhalation, I mean by nose, so that will be inhalation corticosteroid. Either we are taking it systematic way, either we are taking it orally, right? If you are taking it orally, then the drug name it will be like prednisolone or like methyl prednisolone. Did you remember that? And if you are talking about this systematic, then in systematic it will be like a hydrocortisone and it will be like methyl prednisolone, right? These drug. And finally we will talk about this inhaled corticosteroid. In inhaled corticosteroid there can be like fluticasone, beclomethasone, mometasone, and there can be like budesonide, and there can be cyclosonide. One important thing, this cyclosonide, yeah, the name itself is like just mnemonic, not good one through. Anyways, so cyclosonide, this cyclosonide is known as soft steroid. Why so? Because it doesn't cause much side effect, especially it doesn't cause that candidiasis. Okay, so that's why this cyclosonide is known as the soft steroid. We have to remember this, they are less side effect. Now basically these steroids have these all drugs we are giving in asthma. Okay, but basically the steroids have a side effect which is common, which is very common. Okay, so let's just talk about it here. So that the side effect is uh, oropharyngeal candidiasis, right? Means in the oral cavity and in the pharynx there is candidiasis, fungal infection. This is one of the type of fungal infection. We know that. How we will prevent it? We can just use the spacers or gargle. We will advise patient to gargle. Okay, so like when the patient is taking drugs like steroids, when the patient is taking, then that time we will advise the patient to do gargles and to use spacers for taking the steroids. Okay, and how we will treat this basically? So for treatment sorry, for treatment we will use cotrimazole, and if not available then we can use nystatin also. Thank you.